Hi, my name is Ronald Valdez, and I'm going to be talking about Ghana healthcare system for the subject HCA 620 Health Policy. So Ghana has the National Universal Medical System, and they call it National Health Insurance Scheme, which was established in 2003, and it is operated by National Health Insurance Authority. So pretty much it is a universal healthcare. It's a healthcare for people, for all people. Health services in Ghana is provided by the government, including university hospitals and clinics, the Christian Health Association of Ghana Hospitals and Clinics, and private facilities. The payment system in Ghana is done in a monthly basis. So pretty much a patient goes to the hospital, and then at the end of the month, the hospital or clinic bills the government, and in return, the government pays them for whatever the cost of the visit was. There are various issues identified as far as quality of healthcare in Ghana, and some of those issues are the inequity in accessing healthcare services. This is because the distribution of human resources and health facilities varies among and within regions. It tends to that urban population and richer households are more likely to have a valid NHIS card compared to those rural and poorer households. It was also identified that pregnant women from poorer households deliver less often in health facility than those from richer households. Number two problem that they have is the administrative structures are ineffective. This is because the existing guidelines that they have is uncertain. They are not being evaluated on a regular basis. These guidelines and protocols need to be updated, but they're not being done so because they don't have the homegrown consultative process, which is supposed to identify high priority topics as well as to develop and continuously update those clinical guidelines. And another factor that contributes to this problem is those guidelines and protocols are not implemented religiously. So the quality of healthcare is being affected. It's not improving. The third problem that they have is the lack of adequate equipment. They have some advanced technology equipment, but it's not enough for every healthcare facilities in the country to use. So they don't have that capability to diagnose and treat patients with the use of this most technologically advanced equipment. Number four is lack of commodities and registries. They don't have available supplies, most especially when it comes to drugs. Uh, Drugs that are essential in treating those patients, they're running out of it. They don't have the continuous flow of supply uh, to help them out in doing their job. Number five is non-adherence to laboratory examination, counseling, and treatment protocols. Well, we can tie this up to the ineffectiveness of their administrative structures. If they don't have the most up-to-date guidelines, clinical guidelines, then yeah, they cannot stick to a protocol that is not up-to-date and that is so uncertain. Number six is unprofessional staff attitude. Again, this is a human factor that could be resolved through trainings, customer service training, developing the rapport between staff and patients. Number seven, patients not adhering to prescribed treatments. Well, part of this problem is from the providers. Maybe because the providers did not explain the treatment protocol to the patient to the point where the patients can't understand what those prescribed treatments are. or they just don't trust uh, their providers. So these are the factors that are contributing to the poorer quality of healthcare in Ghana. In 2015, 5.91% of the gross domestic product of Ghana went to health expenditure. That's about 79.59 US dollars per person. So how do they finance this national health insurance system that they have? Well, they have four sources of uh, uh, money. Okay, one of them is the National Health Insurance Levy, which is about 70%. 70% of this goes to the NHIA, and these monies come from the 2.5% taxes imposed on goods and services in the country. 17% comes from Social Security and National Insurance Trust. This comes from the 2.5% contribution to Social Security and National Insurance Trust. Premiums, 4%, which is the average premium ranges from $6.40 to $10.64 per annual. That's US dollars. And other sources. These are from investments, grants, parliamentary. It's about 8%. Uh, more, more like 99%. That comprise 99% of the financing for the national health insurance. So enrollment in the program is mandatory but not mandatory. Well, it's kind of like gray area because by virtue of Act 852, which is the healthcare policy in Ghana, you are mandated to enroll into the program, but then at the same time, there was no penalty for not enrolling. So that's kind of like where the gray area is. It's mandatory but not mandatory. So people of Ghana can still opt out of the program if they don't want to be part of the program. You know, as far as for the formal sector, they are enrolled by default because, of course, they have a regular job. They get paid every month. But when it comes to the informal sector, they have to voluntarily pay the registration fees and premiums to be part of the program. I think that's where the not mandatory part comes in, you know, because they are not being forced to be part of the program if they don't want to. Maybe for some various reasons they can't afford it, they don't have money, or they just don't want to be part of the program. This is the end of my slide. If you have any most recent information about the Ghana healthcare system, feel free to put it in the discussion board so that we can know it, we get educated for it, and so that we can learn from it. Thank you, and have a good day.